Let's go to junior doctors, though, today who walked off wards in hospitals around the country in a 48-hour strike over rosters. The doctors are asking for the maximum number of days they work in a row to be cut from 12 to 10. That's on the trot. And the number of night shifts in a row reduced from 7 to 4. Our health correspondent Karen Brown reports on how the first day of the strike has gone.
Rosie Chillette from Christchurch Hospital is one of the more than 2,000 junior doctors on strike over what they say are unsafe rosters.
I think all of us here could give you an example of being really tired and not doing as well as we should, particularly on nights after your fourth or fifth night, then you're just not thinking as clearly.
The industrial action still has another more than a day to go. In the meantime, life-preserving services agreements between the Doctors' Union and District Health Boards enable striking doctors to be called on in emergencies. The DHB's National Contingency Planner for Industrial Action, Anne Aitchison, won't give details but says it happened at least once today.
But they have the agreements were made and the calls were made and the staff came.
She says hospital emergency departments, which have remained open, were also less busy today than expected.
In fact, the emergency departments have reported the numbers are down a little bit, which means that the response from the general public who could perhaps get their care elsewhere has been very good.
Hospitals also try to discharge as many patients home as possible before a strike to enable them to focus on acute cases more easily. Anne Aitchison says early today many hospitals were nearly full at 95% capacity, but it'll be down by now.
At 8 o'clock in the morning, that would be what you would expect. Hospitals are usually sitting 100 or beyond first thing in the morning.
OK, so if that was where they were first thing, that they wouldn't be there now?
No, that was 8 o'clock. So there'd be significant discharges throughout the day.
She says the target occupancy rate for hospitals during the strike would be 75 to 80%. That's exactly how Dunedin Hospital started day one of the strike today, bang on target at 3/4 full. The Chief Medical Officer of the Southern DHB, Nigel Miller, says it was calm and quiet when he walked the wards.
I think we've got the capacity to manage the normal acute loads. I suppose my concern would be that people think they can't come to hospital or avoid coming and they turn out to be seriously ill.
A separate row over the extra pay senior doctors will get for providing cover for junior doctors during the strike is expected to be resolved after the strike. Dr Miller says senior doctors in Dunedin and Southland got on with the job today.
Some of them seem to be quite enjoying it. It's a challenge because obviously they're doing things that are unfamiliar. The day-to-day things, the routine organisation, some of the computer things. So it's a challenge, and that always makes me a little bit concerned. But so far, people appear to be getting on with the job.
The Health Minister, Jonathan Coleman, says payment for days not worked is a sticking point in the talks involving possible changes to junior doctors' rosters.
The RDA wants their members to be paid for those 2 extra days off, and that would incur an extra cost of $60 million. And mean we'd have to employ another 160 junior doctors.
That's rejected by the spokesperson for the Resident Doctors Association, Deborah Powell.
The maximum is 140, but the cost of that, and again this is worst case scenario, we calculated around 14 million, nowhere near the 60 million that the Minister quoted.
She says the extra doctors needed for safe rosters would be mainly new graduates who would be already factored into DHB budgets. For Checkpoint, Karen Brown.